Computer. Okay. All right. This meeting is being recorded. I want to welcome Sandeep Nayak to the Kitsap Peninsula Mycological Society November meeting. Take it away.
All right. 1 second while I grab the chat. There we go. All right. Yeah. Thanks for the introduction. And very happy to be here. You all seem like a very warm bunch. And so basically, I have a bunch of slides prepared, a lot of different things we talk about, and I'll tell you kind of what I have laid out. But I also kind of, sorry, I think I heard some interference. Anyway, I also want you all to just feel free to, I'll try to keep an eye on the chat if questions or comments kind of arise during. I'm happy to sort of take those up and diverge as well. So, whoops. Yeah, basically no financial conflicts of interest, anything like that to disclose. So yeah, I mean, today, I guess the three big picture topics that I had kind of planned to discuss were the history of psychedelic science. What are psychedelics? What effects do they have? A little bit about the older research studies and kind of the history into why all of that line of research got shut down. And then I'll talk about some of the more modern research. So I'm a clinician. I'm primarily involved in clinical studies. So I'll kind of walk through like, how do we actually do that? Why do we do the things we do? Psychedelics are being studied for a bunch of different clinical problems, but I'm going to focus on depression and tobacco smoking. And then can talk a little bit about how do psychedelics work in terms of brain mechanisms, psychological mechanisms, and this leaves a lot of different stuff out. So again, I mean, please feel free to drop questions in the chat and I'm happy to meander a bit. So yeah, brief history of psychedelics. So what are psychedelics? So first off, all drugs, with very few exceptions, basically work by mimicking molecules that are naturally in your body. And psychedelics are no exception to this. So basically, serotonin, which is a chemical in the brain that has all kinds of functions, every single psychedelic essentially works by mimicking serotonin. And if you look at these different molecules, you can kind of squint and see that they look sort of structurally similar to serotonin. But specifically, they activate a specific receptor for serotonin called the 2A receptor. And so when I'm talking about psychedelics, I'm going to be talking about drugs that have a particular set of subjective effects, but which act through activating this serotonin receptor, this particular one. So that means what I'm not talking about is ketamine, MDMA or Molly or ecstasy, Amanita muscaria, cannabis, all things that are sometimes also ibogaine considered psychedelics. I'm kind of restricting it in the sense. So what are examples? So obviously psilocybin mushrooms. So this is, I think, psilocybin cubensis, LSD, which is synthetic, mescaline, which is found in peyote and other cacti, as well as DMT, which is found in ayahuasca. And there are a handful of others as well, including some that are found in animals. But this here is a map of all of the different locations where I'm sure this is just completely, there's probably a lot more than this, but this is a map of like different locations where psilocybin containing mushrooms are found. And I believe there's over, you all might actually know better than me, I believe there's more than 200 mushroom species that have contained psilocybin. And again, I don't know the mycology that well, but my understanding is that somehow the genes that produce psilocybin have kind of jumped around horizontally from one mushroom species to another. In other words, normally, you think of, for example, yourself, like your genes are transmitted from your parents to you, to your kids, to their kids. But somehow these mushrooms have a mechanism of transmitting genes directly. For example, if you were to trade your genes with your cousin or your brother or something. And so there's something, somehow this package of how to make psilocybin has kind of leapfrogged from one mushroom species to another. But yeah, so all I really want to convey here is that psilocybin containing mushrooms are literally everywhere in every corner of the world. And yet, despite that, you really only have convincing reports of people using these in ancient times in North and South America. That's it. People will tell you otherwise, but the only convincing evidence we have is for use in North and South America. The ancient Chinese were aware of psilocybin mushrooms, but they kind of regarded it as a poison. Like they wrote about this, do not eat those mushrooms, they're poisonous. Okay, so what effects do psychedelics have? So yeah, there are all kinds of different psychedelics, and some of them have different effects. They're not identical by any means, but by and large, what they share, there's more in common than what differentiates them. And so, this term hallucinogen, everyone kind of, I think, is aware that psychedelic drugs can cause visual effects that can include like walls breathing, that can include colors scintillating or being brighter, or even more funky stuff like hearing sounds, your senses mixing. And, interestingly, when it comes to therapeutic uses, this is all total sideshow. There's not really much that we actually think is useful there. Also, frank hallucinations, like seeing things that are not in fact there, which is actually not the most common. But I would say that the more therapeutically relevant effects of psychedelics are meaning enhancement. So just across the board, things are more meaningful, but also a broadening of emotional range. And that's on both ends. And that can be to the extreme of ecstasy or to like absolute dejection, just incredible broadening of emotional range. And yeah, I'm going to digress a bit. Do we know evolutionarily why psilocybin evolved? I don't, but I think first off, clearly there is some evolutionary advantage to psilocybin. Otherwise, it would not have spread so reliably across all these different species. It's also clearly it's a psychoactive compound. It affects humans in very profound ways. And serotonin is a very, very ancient system. And so it's likely affecting bugs as well. So one conjecture that people have made is that it, some insect or something, it's an animal, essentially. It's eating the mushroom, then it somehow may be deterred from, maybe they become non-functional or something like that. That's kind of the only explanation that I've really heard that has any kind of plausibility. Thanks for adding questions in chat. And then there's all kinds of other effects, but I guess I'll just sort of restrict it. So you hear about these mystical type experiences. I'm going to maybe talk more about what that means down the road, but essentially it connotes like altered sense of self, including loss of a sense of self or feeling like your sense of self is merging with the rest of the world or universe, altered sense of time, including experiences of eternity. And it turns out these are actually therapeutically useful. I'll kind of get into that later. So that's just a little bit of a subsection of what kinds of effects are possible. This is a quote from Aldous Huxley on the kinds of effects on the sense of self. For those of you who don't know, Aldous Huxley was a writer. He wrote Brave New World. And this is him describing some experiences he had after taking mescaline. I was now a not self, simultaneously perceiving and being the not self of the things around me. To this newborn not self, the behavior, the appearance, the very thought of the self that had momentarily ceased to be seemed enormously irrelevant. So this is what we would call ego death. And this is a very prototypical characteristic of higher doses of really any psychedelic. I'll skip over this, but basically, I won't get too much into this unless people are interested, but psychedelic drugs are, as far as drugs go, remarkably safe. They're remarkably physically safe. Can talk more about that if people are interested. So yeah, this is Albert Hofmann. Again, psychedelics are very ancient, and they were first discovered, quote unquote, discovered by the Western world in the form of mescaline, but then sort of forgotten. And so really when the Western world became conscious of psychedelics was totally by accident. This guy, chemist Albert Hofmann in Switzerland, synthesized LSD. He was looking at totally different uses for it and accidentally ingested some of it and essentially tripped. And famously, he rode his bicycle home, and it's still celebrated as International Bicycle Day. This was in 1943, a long time ago, right? And so there was a period, this is a far cry from the 60s. And so there was a period of time when it was very unclear what to do with LSD. And also people began to discover other psychedelics, like psilocybin shortly thereafter was discovered by the Western world. Anyway, so one of the things that people first thought was like, oh, we're having hallucinations, people are, losing touch with normal reality. Maybe this is what people with schizophrenia experience. And so that was a whole line of research, the psychotomimetic research. And maybe this can teach us about how people develop schizophrenia. And it turns out that's probably not true. And that was not a very fruitful line of research, but that whole model psychosis, that was like a whole line of research that people used for LSD. And then there was also kind of this budding idea of like, maybe we can use this therapeutically. And this was kind of this wild era of experimentation in which people were trying all kinds of things before they settled upon some rationale. And one of my favorite examples is the studies for alcoholism. So there were these Canadian researchers, and there was this notion that like to recover from alcoholism, you have to hit rock bottom. This is not an outlandish notion. I mean, Bill Wilson, the founder of AA, kind of had an experience like that. Hit rock bottom, and then you kind of come back up. And people who have very, very severe alcohol withdrawal, I mean, we're talking like life-threatening alcohol withdrawal, they can develop something called delirium tremens. And one of the things that can happen with delirium tremens is that people can hallucinate. And it's very, very unpleasant. Their skin is crawling, they're seeing things, and maybe they're paranoid. And so the rationale that led to these Canadian researchers to try using LSD for alcoholism was, well, let's see if we can replicate delirium tremens, scare people into hitting rock bottom. And instead, what happened was that they were having these mystical, highly meaningful experiences in which they were able to have a different experience of their self, realize that they were capable of changing, and yada, yada, yada. And so they kind of changed the model to try to emphasize those aspects. There's some other therapeutic uses that people tried out. I'll talk about that maybe a little later. But yeah, so this is just looking at the older studies of LSD for alcoholism, and essentially it kind of worked. I mean, it doubled the odds of people remaining abstinent from alcohol. And the quality of these studies, you can quibble about that, but the bottom line is that the evidence that they had seemed to be somewhat promising. And this wasn't just true for alcohol. I mean, here's a study for individuals who were using IV heroin, and I don't know if you can see my mouse, but yeah, this is the percent of patients that are abstinent. And at a year, it's like 5% of people in the control group compared to like 30% in the treatment group. So some promising evidence that LSD was also good for a totally different addiction. Not to mention depression as well, but that whole line of research got shut down. I think most of you are probably aware of the moral panic that took place surrounding LSD. So these are kind of fevered newspaper headlines. Acid party, army of baseball bat brutes. They're all rampaging around. They're taking LSD. They're breaking down doors. They're attacking the kids. LSD made me a prostitute. Son of Sam, serial killer. They're kind of attributing his actions to acid. So not favorable press. And some of this, I think, it was political in the sense that like LSD kind of became wrapped up in the counterculture, anti-war movement. And so certainly like public opinion turned. Richard Nixon signed the Controlled Substances Act, which essentially made all of these psychedelics, LSD, psilocybin, like illegal. But that's not the whole story as to why this line of research was shut down. I don't know if you all are familiar with this, what this is, but these are children without arms. And this was the result of a drug called thalidomide, which was never FDA approved. Yet Americans still, so this is a drug for pregnant women that causes these limb defects. And so this was being distributed around the US despite not being FDA approved under the guise of research. And it was very loose, like you could just do research and kind of distribute a drug around. That's actually how most of the LSD that was being used. It was a very, very loose fashion. And essentially, after the thalidomide fiasco, the FDA kind of introduced new rules where it's like, okay, you have to do like very, very rigid, not rigid, but stringent, high quality research designs. And it turns out that the typical research design is actually does not work that well with psychedelics. But yeah, it was this combination of like public backlash, illegalization. The drug company that sponsored it all, they got wet, cold feet about it all, and they're like, we're not going to supply this drug anymore. On top of the fact that now you have to do a totally different research design. So it all kind of, in effect, it all got shut down for many decades. This is the woman who prevented thalidomide from coming to the US, but it still came under the guise of research. Anyway, we're in the so-called psychedelic renaissance. So these are scientific articles published about, this is psilocybin in particular. And part of the reason why we switch, I'm talking a lot about LSD. Now it's all psilocybin. And honestly, big part of the reason is that psilocybin, which is the active ingredient in magic mushrooms, does not have the political baggage that LSD did. People just don't know what psilocybin is. In effect, psilocybin and LSD, they're not identical, but probably when it comes to therapeutic effects, they're essentially interchangeable. They're basically doing the same thing. LSD lasts longer, it's not so practical if you're trying to fit this in a workday, but by and large, it's just, there's no particular reason why we're all using, psilocybin in these trials now. And yeah, again, you've all kind of noticed the headlines, I'm sure, but there's a totally different tone in the way all this is being talked about. All right, let's talk about modern research. So how it's delivered, some little bit about the effects in healthy individuals, and then there's all kinds of clinical uses. I'll focus on depression and tobacco just in the interest of time. So again, back in the day, people were kind of casting around for all of these different ways that they could use psychedelics. And the way that we do it now, which is kind of called the psychedelic model, was arrived at by essentially blind trial and error. But other things were tried. So for example, the dominant mode of doing psychotherapy back in the day was psychoanalysis. So patient is lying on the couch, they are sort of free associating, they're just talking, right? And you have a whole theoretical, whole set of concepts about how you're supposed to do therapy, how you're supposed to engage with them, the kinds of ways that problems arise, etc. And so people thought that, LSD, it's expanding the emotional range, it's making memories more available, it's all this stuff. Why don't we just try doing psychoanalysis while people are on LSD? And this didn't really work that well. For one, once you hit the higher doses, people can't really talk in the same way that they just cannot really grapple with concepts in the same way. But two, some of the things that would happen, psychoanalysts would sort of write off as these are distractions. So people were having these mystical, spiritual experiences, this sense of rapture, but the psychoanalyst would sort of think you're not really getting to the heart of the matter. You're sort of not really dealing with your problems. This is a sideshow. And they didn't really take advantage of what the treatment had to offer. Other people, they just tried to give it as a drug. So here's the same way that you take an aspirin. And the proponents of the model that we use now, some of them would go so far to say that psychedelics don't have any intrinsic therapeutic benefit. It's really all about how you use it. I don't think I would personally go that far. I think it's mostly, it is mostly about how you use it. I wouldn't go so far to say that the drugs themselves have no therapeutic benefit, but the basic idea is that like psychedelics kind of are tools that can be used in combination with therapy of some kind to guide people towards certain kinds of experiences that can be beneficial. Um, and yeah, I don't know. There's a couple of other models we can maybe skip over those, but basically trial and error, they arrived at a pattern of use that seems to work, and that's what we all do now. And so the three elements of the psychedelic therapy as we use it now are preparation, dosing, and integration. So preparation is, I was going to say it's the most important part, but they're all the most important part. You basically are with your two guides and the patient and the guides, they really get to know each other very, very well. And so they review their life history. You know, they spend like 8 to 12 hours together over the course of weeks, where you review your life history, you kind of go through all the different experiences you've had, what's going on now, who's important in your life. Basically, you try to really get to know each other and establish a sense of trust. Really critical to establish a sense of trust, because people are going to be having all, it's critical that people are able to let go and just be present with the experience. And also though, like if you look at all the stuff that psychedelics are being studied for, there's almost not really a common theme. Like, and so again, it kind of fits with this idea that maybe psychedelics aren't necessarily antidepressant. They're not necessarily anti-smoking. They're not necessarily anti-drinking. It's what you are able to do with the psychotherapy that allows the psychedelic to then be beneficial. And so the preparation is also in part about not only exploring what the problems are, but creating some kind of intention about dealing with it. And it's not heavy-handed. It's not like you need to think about this, you need to find, but it kind of lays the groundwork. And so now you have your two guides that you trust, who you feel like really know you well, and you've explored the problems. And so this is the dosing room. And basically oh yeah, so the other element of psychedelic therapy is that your eyes are closed, you're listening to music, and the focus is internal. So this was actually very surprising to me when I started, because you think of, guiding, right? But actually the guides are not doing very much hands-on. They're there to help you stay present with your own experience. And so we kind of use certain mantras like trust, let go, be open, give your intellect the day off. It's really in many ways unguided, it's undirected. The idea being that you have the resources that you need to solve your own problems, and if you kind of trust yourself, you'll get there. People can have, that being said, people can have all kinds of frightening experiences, like, but even with those, we sort of advise people to really just try to be present with your experience, non-judgmental, roll with it. And these can include, again, there's a whole range, right? Like people can have experiences like they're experiencing their birth, or that they're meeting God, or that they're talking to a deceased loved one. But they can also have experiences like they're dying, or they're going insane, or that. And yeah, we tell people, if you feel like you're going to die, let yourself die. If you feel like you're going to go crazy, let yourself go crazy. We are here to kind of make sure that you are safe. We will not let anything happen to you, but your job is to just be present with your experience and just try to roll with whatever's happening. And very often you'll see that when people do actually accept whatever's happening, they come through to the other side. So that's dosing it. And obviously if people are having a difficult time, we are more hands-on, we are more verbal, we are more, but sometimes it actually looks like we're sitting there and they're kind of dead silent for hours at a time, not moving. And that kind of brings us to integration. So really, after they have this experience, now it's time to make sense of it. And that kind of unfolds over time. And not only make sense of it, but also turn it into something that can be useful. And that's going to look different depending on what the person's problems are. Therapy sounds David, therapy sounds an awful lot like a regular trip. Therapy here is a lot like a regular trip. And I guess the other thing that I should mention is that sometimes people think, oh, this is research. They must be using kind of pretty low doses. These are quite high doses. If any of you are familiar with, dosing of, psilocybin mushrooms and like dried psilocybin mushrooms, so we're obviously giving pure psilocybin, synthesized psilocybin, but the equivalent of what we're giving in dried psilocybin mushrooms is 3 to 5 grams. So it's quite high actually. So these are like quite, bordering on quote unquote heroic dose trips that are occurring in the context of quite a lot of support. So we're not giving them cubensis or cyanosins. It's pure synthetic psilocybin. There are actually going to be some studies of using mushroom derived and even extract, like mushroom extract. But yeah. And thanks again. Any questions, please drop them in. So this is actually quite different from like typical therapy. And I ran across this quote the other day and it made me think a little bit about psychedelic therapy. I'll just read this out. But this is about, this is an individual talking about their experience of Western therapists who came to Rwanda after the Rwandan genocide. And she said, "We had terrible problems with Western mental health workers after the genocide here. They used a technique that did not involve getting out into the sunshine, didn't involve music, which gets the blood flowing, didn't entail specifying the depression as an external invasion that could be cast out, didn't involve opening up about the need for help and involving the whole village in support. Instead, people were taken one at a time into dingy little rooms and asked to talk for 50 minutes about how miserable they were, which just made them feel worse. And we had to put a stop to it." And yeah, and then I'm reminded of a Stan Grof quote, Stan Grof being one of the primary architects of the way of using psychedelics therapeutically that we do now. And he's kind of drawing a distinction between psychedelic therapy and sort of more conventional psychotherapy. Excuse me. An important part of the preparation is the therapist's explicit and implicit emphasis of the growth potential of the patients and an encouragement to reach the positive resources of their personalities. Unlike conventional psychotherapy, which usually goes into detailed exploration of psychopathology, psychedelic therapy tries to discourage the patient's preoccupation with pathological phenomena, be they clinical symptoms or maladjustive and interpersonal patterns. In general, there is much more concern about transcending psychopathology than interest in its analysis. Both of these quotes kind of remind me, I mean, it's like, yeah, this is actually what you see a lot with psychedelic therapy. People have a problem, they feel like they need to resolve the problem. But quite often what ends up happening is they just grow around it. And so the problem itself doesn't quite seem to be, in a way, sometimes they actually don't solve the problem. But the problem just seems less of a problem. I don't know if that makes sense. But it does feel quite different in character from typical psychotherapy. I said I would come back to talk about the mystical piece. This is a study in healthy volunteers where they received psilocybin or methylphenidate, which is Ritalin, like a stimulant for ADHD. The Ritalin is a control to be able to compare the effects. And these are just different elements of mystical experience. So unity, the sense of interconnectedness or all is one, transcendence of space or time, deeply felt positivity, etc. And you can just see like across the board, psilocybin is causing quite a bit more mystical type effects than than Ritalin, and 100 is max score. So it's actually quite high. Notice that Ritalin's not 0. And actually, in one of these studies, one of the Ritalin participants actually had a full-blown mystical experience. So it just goes to show, like, it's not just the drug, it's also the way that the drug is being used. And oops. The odd thing about this is that the effects, so they seem to last. I mean, the drug is out of your system the next day, basically, but the positive effects, so in this case, we're looking at healthy volunteers, we're still looking at psilocybin versus Ritalin. The black is psilocybin, the white with bars with the diagonal lines is Ritalin. And it's looking at changes in well-being and life satisfaction 2 months later. And mostly people who got psilocybin are saying it increased moderately, increased very much. And mostly people who got Ritalin are saying no change or increased slightly. So months later, people are attributing positive changes to this single experience, which is fairly remarkable. And not only were they positive changes, they also were highly meaningful. So roughly, I don't know what that is, like 60% of people who received psilocybin found the experience to be among the top 5 most meaningful experiences of their life. And that was still true 14 months later. And that's also true with their top 5 spiritual experiences, etc. So again, basic takeaway here is just that these are very brief experiences in the grand scheme of things, but they have very, very enduring effects, including on things that you don't really expect to change. So personality, as measured a variety of ways. We often use this thing called the NEO. It's like a personality measurement, it measures different aspects of personality. And it's generally very stable. It's not really supposed to change yet. Psilocybin, as you can see here, so these are people who had a mystical experience. These are people who did not. Those who had a mystical experience, their openness, which is an element of personality, actually increased over time, whereas those that did not, it kind of stayed the same. So Tom, your question about what therapy model do we use? I think I'm gonna kick that down the road. I'm happy to expand on that in a bit though. And what are the differences between one, few, heroic? Yeah, so microdosing is a whole nother issue. And it's actually something that I don't know a lot about, but it's totally different in effect. Maybe when I begin to talk about some of the biological stuff, I can try to rope in microdosing. Let's see, how are we on time? I'm gonna actually skip ahead. There are risks to this. They're primarily psychological. It's very physically safe though. Okay, so I'll talk about depression and tobacco stuff. So basically, there's been a couple of depression trials. Let's just focus on the ones that have control groups, the better quality ones. So this is one that we actually did. And there's a group that gets psilocybin early, there's a group that gets psilocybin later. And so you're taking a look at like, how do they do in comparison? And just for a sense, so on this scale, this is a depression scale, 8 to 16, this is mild, and severe is around here. And yeah, as you can see, the people who got psilocybin, they had a pretty quick drop that lasted up to 2 weeks that was, dropped them into the mild range, and the people who did not, they basically just didn't budge. So 60% of the people who got psilocybin were in remission after a week. Any thoughts about why those who had no mystical experiences scored lower on the openness scale after? So they didn't score lower, they just didn't change. So this is how they were before. So as you can see, these people are, these error bars, they kind of overlap. So basically what this means here is that before they have the psilocybin, both of these groups are basically the same. And yeah, it looks like it's going lower, but it's there is some variability when you measure these things, and it doesn't actually like statistically, it's not actually different. Whereas this increase is large enough that it is statistically different. So I don't think that they're actually going lower. I think that there's just some variability when you measure things twice, if that makes sense. When you're doing experimental trials of psychedelics, can you really have a control group? The control group would know that they didn't get the drug, while the treatment group knows that they received the drug dose, and that could change their behavior. That's the million-dollar question. So, yeah, I think here, the gold standard of doing research is with blinded randomized trials, right? And in effect, doing a blinded trial with psychedelics, it's not necessarily impossible, but we haven't seen proof of it yet that it's doable. And the reason is because when you get a high dose of a psychedelic, it's kind of clear that you got a high dose of a psychedelic. And when you get placebo, it's kind of clear that you got placebo. This isn't true across the board. I mean, some people who get psilocybin genuinely believe they did not. Some people who got placebo genuinely believe they got psilocybin. There are ways around this. You can use other control groups, like, for example, cannabis. There's a whole range of things that need to be explored. But there are also other ways of testing things that don't necessarily use blinded studies. Maybe when we get to the tobacco stuff, I'll kind of get into that. Okay, so basically, yeah, this is a study showing improvements in depression. This was a study from London where they compared psilocybin to, this is a common SSRI called Lexapro. And so day 7, 14, 21, 28, you can see psilocybin does somewhat better than Lexapro, but it doesn't actually beat Lexapro. I mean, when these error bars cross, it means that, maybe it's lower due to chance. So it's a little ambiguous, but they're comparing it to an active drug, not placebo. And so generally speaking, people kind of take this as evidence, again, that psilocybin seems to be helpful for depression. Over that. This is like brand new as of, I think, yesterday, brand new trial. So here they, again, it was for depression. Here they have placebo. So remember, when you're in a clinical trial, you're interacting with all these warm people who are trying to help you, and you're getting out of the house and you're showering and you're shaving you're doing stuff that is actually good for you and antidepressant. So even people who get a placebo end up doing better. So this gray line is placebo. This green line is 10 milligrams of psilocybin, which is a pretty low dose. It's not really enough we don't think it's really enough to work. It doesn't really cause all of the effects. And this blue line is 25 milligrams, which is roughly 4 grams of dried mushrooms. And yeah, as you can see, that by week 6, 10 milligrams not doing any better than placebo, but 25 milligrams is still quite a bit better. So this is probably the biggest trial yet. They haven't actually published it yet. It's just a press release. Let's see, how are we on time? Tobacco. You know what? I'm gonna skip over this and we'll talk more about an ongoing trial we have. So basically there was an early trial in like 15 people that showed that psilocybin seemed to be helpful for quitting tobacco. And this was open label, meaning there was no control group. And so if you don't have a control group, there's all kinds of questions. Like, you don't really know if it was a psilocybin. What if this was a really motivated group of people? What if they were just, a very dynamic study team who was able to motivate them to quit, whatever, right? And then there's also this problem that Bob is pointing out, where you don't really know what you're comparing. If people who get psilocybin know they're getting psilocybin, maybe the hype and the excitement is enough to actually make them better. And so one way of getting around this is to study something where you kind of know about how good you can get. So with tobacco, the treatments we have for helping people quit smoking are very bad. So I'll just skip ahead here. What we're looking at here is a table of like at 6 months, somebody starts a new treatment to quit smoking. How many people have quit smoking? And the best treatment we have is long-term nicotine patch, plus they can take, like nicotine gum or nicotine lozenges whenever they kind of feel the need to. 40% of people, mind you, that's a minority, are not smoking. And then there's these other treatments that are doing even less well. But basically no treatment we have, and this includes psychological treatments, which I'm not showing you, seems to get more than 40% of people reliably quitting at 6 months. And so there's kind of a ceiling on about how good can any treatment be. And so in this trial, which is ongoing, we've done about 60 people. Here, maybe this is the best way to look at it. You basically have everyone gets CBT for smoking cessation, and you do that for a month, right? And then you get split into 2 different groups randomly, but people know what groups they're in. And one of these groups gets psilocybin, big dose of psilocybin. The other group gets nicotine patch, basically. And that goes on for like, 12 weeks? No, it's like 8 weeks, I think. And then you kind of see what happens after 3 months, 6 months, 12 months. There's not a lot more that's going on here. This is kind of, 1 to 13 weeks is when you're really with them, and it's pretty hands-on. It's like a very high quality psychotherapy intervention for stopping smoking. And then this group gets nicotine, this group does not, but they get psilocybin. And again, just keep in mind that like 40% is about as good as any treatment has done. And these are the results we have so far. So this is the percent abstinent, and these on the bottom are the time points. So 3 months, 6 months, 12 months. The red line is people who got psilocybin. The blue line is people who got nicotine patch. And yeah, at 3 months, people who got nicotine, it's about 40%. And psilocybin, it's not that much higher. It's like a little more than 45%. But then look what happens as time goes on. Like 6 months, only 30% of people who got nicotine patch are not smoking. And psilocybin group, it continues to go higher. It's like crosses 50%. And it's still not the best. Still a large chunk of people are smoking, but this seems to be beating the best combination treatment there is. Again, there's still problems with that, but this to me is fairly convincing that it is actually working. And yeah, so let me just kind of read out a representative example of somebody's experience in this tobacco trial. So he said, this really was one of, if not the most profound experience of my life. Not only did I see God, but I experienced a sense of unity and love like I've never experienced before. Not only could I see it, but I could feel it. I could almost taste it. It was thick and intense. It has changed the way I look at people, nature, life, decisions, the difference between right and wrong. Cigarettes no longer feel like a part of my daily life, and my urge to be healthy has overtaken my urge to smoke. I saw my body being cleaned out of all the impurities I have placed in it over the years, and I'd like to continue to keep it that way. This is a representative report. This is actually kind of a typical description of what people say. It's a particularly good one, mind you, but it's not at all unusual. I didn't like cherry pick like something that only one guy experienced. And so this gives you, I think, a bit of a flavor of how it may be helpful. How do psychedelics work? So I kind of, first off, subscribe to the notion that like it's the experience that you're having is what's helpful. And you can kind of see in this man's description how the experience is meaningful and contributes to him, ceasing tobacco and continuing to do that. But there are also, it's a drug. There are biological changes that occur that might explain why a single day could lead to some lasting benefits down the road. So this is a pretty famous picture. And it's actually a picture from neuroimaging studies, so an fMRI study, so brain scan basically, where you kind of see the pattern of activity in the brain. And at this point, there's now a bunch of these. I actually don't know what the 9 Perfect Strangers show is, so I don't know how to answer that. But there are a bunch of these fMRI studies, and the basic finding that replicates is that normally your brain has a certain way that this part of the brain interacts with these parts of the brain, this part of the brain interacts with these parts of the brain, and there's a pretty typical pattern that different parts of your brain interact with each other. And that is what is sort of intended to be represented here. These like lines interconnecting. These circles are different brain regions, and the lines that interconnect are like the way that they're talking to each other. And this is the kind of normal, typical brain. And the brain on, I think this is actually LSD in this case, but it's the same idea, is basically just different parts of the brain are interacting with all kinds of other parts of the brain. And the normal connections, like, they're just not there in the same way. And so, yeah, just kind of globally, the brain is more interconnected. And the analogy that's used is like shaking up a snow globe, and it kind of allows things to settle in a new pattern. But looking at a different level of the molecular level, so this is a study. This is with neurons in like petri dishes, so it's not actually in living things, or animals really, but it shows that psychedelics, like in a petri dish, kind of increase your brain, your brain cells. Actually, don't know how to break this down in plain English, but your brain cell, every brain cell has to make connections with other brain cells. That's the way that you learn. That's the way that your brain changes, and that's kind of this is how you're able to learn new things and change without having new brain cells. The connections between brain cells changes. And this is actually during the experience. There are scans after as well, but this one in particular is during. Sorry, I was jumping back to answer a question in the chat. But yeah, basically it increases brain cells' ability to form these new connections. This is in a petri dish, but this has also been shown in like kind of living, behaving mice. Give this mouse psilocybin, and it'll kind of immediately form, these brain cells will immediately form like new spines. So it seems like, shake up the snow globe, allow for connections that aren't normally possible. And maybe this explains why, for example, people can hear colors or see sounds. But also maybe the reason why whatever beneficial effects happen, new self-understanding, maybe this kind of stuff explains why they can actually last. But really, the meat, I think, of why psychedelics are beneficial is it's psychological. And that's kind of why I keep harping on, I call it psychotherapy, because psychotherapy is a treatment that works on a whole range of diagnoses that, generally speaking, is about the person and their self-understanding and their way of interacting with the world and their behaviors. It's much broader than, it's much broader, basically. And it works through the person's experience. There is no such thing as psychotherapy without the person's experience. You give somebody an antibiotic, it'll kill bacteria whether or not they're aware of it, right? And I've already kind of touched on the fact that these mystical experiences occur, but one of the common themes that occurs is that people feel a greater sense of connectedness, and that's broadly. They feel a greater sense of connectedness to themselves, to the people around them, to nature, to people in general, to the world at large. And one of my colleagues, which I think is a very apt term, calls it like a social connection with the world. And in this kind of modern day and age, like that, this is one of the fundamental problems. We're all hollowing out the normal ways in which we've typically connected with each other. And psychedelics, it's not like they fix that, right? But they do foster a sense of connectedness that people are then able to kind of go out in their life and begin to implement. Maybe they'll call their relatives and they'll form new communities and whatever. But also there's this altered sense of self. And sorry, have there similar studies been done for senility? We are doing a study in Alzheimer's disease right now. And I don't think that it's likely that psychedelics, psilocybin, is going to reverse any of the memory changes that have occurred. I think it's quite possible that it will help people with the mood alterations, but also to accept their illness. Once somebody actually develops Alzheimer's, I mean, that's actually quite far down the road when changes to the brain have been happening. So yeah, one of the things that occurs when you have an altered sense of self is that you realize that you can be different. One of the patients that I recently had in an alcohol trial described, this, it was also depression. This guy was depressed, right? And he spends a lot of time beating himself up, thinking about all the ways in which he could be better and all the things that he didn't do right. And while he was on this psychedelic trip, and this is a guy who didn't really have much in the way of a mystical experience, but he did experience himself in a different way. And he could kind of see that, oh, I'm having all of these negative thoughts about myself, and this isn't the way that my family thinks about me. And he came to see his normal way of looking at himself, this is his own words, a funhouse mirror that distorts everything and makes it like warped. And he found it comical. He actually laughed at this. And in stepping away from his normal mode of looking at himself, he, one, was better able to understand what everyone else around him has been saying this whole time. You're a lovely, wonderful guy. But two, actually began to see doing this as a choice. Not saying that it's an easy decision, but he was then able to kind of carry that forward and make decisions to try to practice being kinder to himself. And you can see how that could be beneficial for depression. And that also is one of the examples of these kinds of insight experiences that can happen. How are we doing on time? That's actually an hour. So I'm basically done. Maybe we can just.
Yeah, but I'll bet we've got lots of questions. We've got
Yeah.
a few in chat, but folks, I'm suggesting that maybe if you just have a question, hold down your space bar and ask your question and just take turns, and maybe that method will work. But I'm going to kick it off because you're doing this as research, and the question that keeps popping into my mind is, okay, let's say that at some point in the future this all gets approved, this is an accepted modality. What's and let's say I'm a very depressed person and I go in for therapy for that. How is that going to be different today from the future? What's going to be different in terms of treatment of ordinary folks?
Yeah, so basically the question is like, this is research. If this stuff gets approved and your average Joe with depression goes and gets treatment, how's it going to look different? Mm-hmm. Well, it's a very good question. I don't really know the answer to that, but I will tell you that what we do right now is not workable in terms of, like, you have two highly skilled therapists who are spending minimum 8 hours before, 8 hours during, and probably like 8 hours after. Not to mention that, like, probably in real life, there are going to be more than one dose. I didn't really touch on that, but more doses seems to be better. And so, I don't know, you're looking at like 30 to 40 hours times two. Mm-hmm. And already there's kind of like a shortage of mental health. But the other advantage of this, though, is that this can be sort of, it's a treatment that you can kind of graduate rather than sort of being. Bottom line, though, I think that they're going to need to make that more cost effective. And there are ways that you can do that without sacrificing quality, I think. So one way would, for example, be, rather than doing this individually, you do it in groups. And traditionally, that's usually how psychedelics are done. In ceremonial settings, you have a group of people, and there's actually reason to believe that might be better because, again, there's this element of connectedness, right? That very naturally leads into group therapy and forming communities. And there have been now studies that have done psychedelic therapy as part of a group, and there is reason to believe that that could not only be a nice cost-saving thing, but genuinely better. Yeah, that's one way.
Mm-hmm. Or you and your friends just get together with something you picked up on the lawn. I mean,
Yeah,
you're not, you're not painting a very bleak picture of natural personal, treatments in opposite, in competition. I mean, dried mushrooms are the same, right?
dried mushrooms are probably the same. Yeah. So yeah, I mean, this is, I don't think that the medical system should be the only avenue for people to, these drugs have some risks, and I didn't quite get into this, but there are people who probably should not take these, but those risks are actually fairly manageable. And I think when you look at, in terms of dangerousness of drugs, psychedelics are actually fairly low. They do have risks, but those risks can be managed. And so I also don't think that like treating a psychiatric condition is the only legitimate reason for people to want to try these. And so, yeah, it's kind of a thorny topic, but yeah, I think you get what I'm getting at.
Yeah. All right, somebody else ask a question, please.
Yeah, historically, these peyote and mescaline and all and the mushrooms have been used as spiritual tools, and there always have been shaman or guides who use those. And I did some reading not too long ago about how disappointed or upset some of the people in Mexico were with the first man who went from the United States down in the 30s and experienced what the particular woman who was famous for her treatments did, and she was happy to have him, but then when she discovered that he took the information back and basically secularized it, talked about it not in terms of what she was doing as a spiritual guide to help a person improve his or her life or to get better insight into personal situation, but as a way of, taking trips. And when you look at the way popular culture deals with these the things that can be mind altering and personality altering, now I'm not trying to throw a wet blanket on it, but I'm wondering how turning psilocybin loose as a drug on a culture that doesn't know how to deal with the drugs we've got is kind of scary to me.
Yeah. And yeah, I mean, I agree, actually. The woman in question went by the name of Maria Sabina, and I think she was actually right to be angry.
Right. Yes.
She reaped
fascinating story.
Fascinating story. And I totally glossed over it, but she reaped no benefits from doing this, and in fact suffered quite a lot. Her whole village was furious at her. There was all these hippies wandering around now, and yeah, I mean, you look, we saw what happened already. We saw what happened when psychedelics were unleashed upon a culture that was really not prepared to deal with it. And it wasn't simply that there was an unfair backlash. I mean, people were going buck wild with them and doing all kinds of outlandish stuff. And so I do think that there does need to be a much more measured way of rolling out psychedelic use. And I'm actually not somebody who has these utopian ideals of this is going to fix all the problems in our society. I have a very narrow focus in my own interest here, which is I'm a psychiatrist. I treat people, and I realize that not all of them can be treated with the tools that we have. And this is actually a very promising tool. And I think that like within that context, I feel very confident that we can, keep safeguards in place to prevent things from running off the rails. But yeah, I mean, I do have some worries about what happens when,
We don't have a particularly introspective culture. We used to have a much more introspective culture, I think, than we do now. But there's so much of it, to me, that's surface. Whether that's good or bad, I think that's the truth. And I just can't imagine what some people would experience if they confronted with what they would be experiencing with these drugs.
Yeah.
Other questions?
I have a question. So just real quickly, you hit on that there can be like psychological dangers to taking a trip, but you said, but very little physical. Can you elaborate just a little bit on that? Like, I don't know. I remember being a teenager or something. People would say like, "Oh, you're killing all these brain cells taking psilocybin." Does it have negative physical effects, or is it all just kind of like things can get scary, make it through that trip sort of thing?
Yeah, I'll back up. I know you can't see my screen, but I'll try to pull it up. I think the best example though that I could give you is in terms of the non-physical the lack of physical toxicity of these drugs, is that so LSD, right, is dosed in micrograms. A microgram is 1,000th of a milligram. It's a infinitesimally, it's so tiny, right? And there have been cases of people where they had powdered LSD, right? They thought it was cocaine.
Oh no.
All right, and I don't know what a line of cocaine is in terms of milligrams, but let's say it's a couple of milligrams. It's like way more than a typical. Again, we're talking about a typical dose is like it's measured in like 100 micrograms, right? So 0.1, but basically massive overdoses. It's more than a couple of milligrams, but we're talking massive overdoses of LSD, and nothing. These people go to the hospital. Maybe they have a little bit of extra bleeding from cuts, but nothing really happens. They're fine. The principal danger is psychological. There is also danger. There is some. I would say I don't want to downplay the fact that it's psychological. I mean, there's actually quite significant psychological risk, and in particular, people that have bipolar disorder are at risk of being destabilized. But physically, during it can raise your blood pressure and heart rate, and so if you have cardiac issues or heart problems, that could actually be quite significant. It's not addictive at all. That's in fact, it's anti-addictive. Like if you take a large dose of psychedelics like LSD, the next day you cannot.
You don't want.
Not only, I mean, it's kind of like, not only do you not want to, in the sense of you don't want to go skydiving every day, but also your body quickly develops tolerance. It's not possible. So yeah, it's remarkably physically safe, but that's not. It's psychologically can be perilous without the right preparation.
One more quick back on that. What about wives' tales of people taking a trip and never returning? The guy in the insane asylum who thinks he's an orange and he's going to get peeled because he ate too much acid.
Yeah. So
true.
So basically, I mean, I'm pausing because I want to. Again, there are some people who
that I thought would never end. You know what I mean? It's been a long time since I did that. When I was like a teenager, we just drank too much of this tea, and 7 hours later, I was like, we're gonna be like this forever, and it was scary. And we eventually came back to Earth. but
Yeah.
but it was unpleasant.
That's a common thing, but I think in terms of a trip that never ends, that doesn't happen. But what can happen is that certain people who are predisposed to certain mental disorders, most particularly bipolar disorder, but also other things like schizophrenia, so psychotic disorders, psychedelics can trigger those. And so, I mean, I have seen this, not in the research side, but in the clinical side, where somebody takes a psychedelic, they have bipolar disorder, and now they're, raving manic. We in the studies, we actually exclude people who have personal history of these or even family history of these, and we've not seen this once.
I had a question of one of the indications I read years ago was in terminal patients, hospice patients taking LSD toward the last days of their life and having mystical experiences that were all positive. And there was a whole idea that, wow, these people would have, quote, bad trips. But the research indicated that what I read was that all the stuff that came out was that they had wonderful trips, actually prepared themselves to death, and actually it was a good thing to take. Have you read anything more about that? It was one of the indications that I read that of actually for LSD.
Yeah, in a way, it's kind of unfortunate I didn't bring that up. That's in many ways the most logical use case of psychedelics. People that are dying, because the experience of, quote unquote, ego death is one where people die and they realize that things are okay. I'm exaggerating a bit, but those experiences lead to peace with death, and they realize like the gift of life, and they have time left, and they want to spend it in a good way. And that is an active area of study. I will say though, and I can share a story that I talked to one of the NYU psychiatrists who worked on this cancer study where people, and she said this person had a terrible experience and she was in agony and was inconsolable. And even this is actually an extreme example, I'm telling you. And they were unable to console her. The next time she came, she was still in distress. But then a week later, things began to settle, and she was able to make sense of it. And I mean, these things can unfold over time. So maybe one of the things I didn't quite emphasize is that the goal is not to avoid a difficult experience. A lot of times, the difficult experience is very necessary, and it brings up some of the challenging things that people are maybe tempted to avoid, but it also offers the opportunity to resolve it in some sense. It's not all like ecstasy and happy-go-lucky and meeting God. A lot of it's like quite difficult and challenging, but it's different for everyone.
Sandeep, could you say something else about microdosing? You kind of pushed it to the
So microdosing is definitely not working on the same model. So the model of the psychedelic therapy is that you have this experience, and the experience is what is beneficial, right? With microdosing, the point is to not really have any experience. Like if you're having an experience, you're not really microdosing. You've taken too much. And so some of the idea may be, and we don't have any scientific proof yet that microdosing is beneficial. And in fact, we actually have a little bit, I don't want to say too much because we don't really know yet, but we have a little bit that like maybe microdosing is not doing all that much. But some of the stuff I showed earlier about how maybe psychedelics are helping people become more, plastic. In other words, better able to change. Maybe some microdosing is doing some of that, even though they're not feeling necessarily the typical psychedelic effects. So I don't know. I think the jury is still out, but the little evidence that we do have is not all that impressive, to be honest, in terms of microdosing doing a lot. And I'll just tell you up front, I'm personally skeptical of microdosing, but I don't think we really know.
Okay, thanks. I'm sure there's more questions out there.
This is Meg. I've got a question with regards to companies that are out there that are doing research, and if you have any insights on what is promising out there, like with either Compass Pathways, Mind Medicine, Society Pass, New Relic, any of those. Is there anything that you're aware of that looks promising?
Yeah, it's incredible how quickly there are new like you actually named two companies I've never heard of.
A couple of them just went IPO, so in like the last couple weeks.
Yeah, I can't keep up. I think that the name of the game right now is basically just kind of advancing the clinical trial. So Compass, for example, one of the graphs I showed, FDA, for FDA approval, you do phase 1, phase 2, and then phase 3 trials. So one of the things I showed that I said came out like 2 days ago was a phase 2 trial. And so, yeah, I think Compass is definitely, this is like maybe the largest company in the psychedelic space, and they're kind of pushing things forward. In a way, nobody's really doing anything novel. Like we know that there are certain psychedelics. We all suspect that they're therapeutically useful, and so it's almost like whoever gets there first. There's plenty of space to do novel things. I just don't think that's quite happened yet. But definitely, like, Compass is like far ahead of the game, and will likely get approval. I don't know if that answered your question or not.
Yes, to an extent it does. It's hard to know, what's coming along with the different trials and how promising they really are at this point, and whether they're going to have a hopefully a successful kind of treatment for a variety of different issues that are out there for people.
Right. I'm encouraged by the recent Compass results. And it kind of starts off with the research doesn't work, but then things kind of migrate into a regulatory issue. Like, how are things going to get regulated? We show that it works for depression, but there's preliminary evidence for this or that. Are people free to I don't know. It's kind of hard to say. It's still early days, though. I think that this will become clearer, and frankly, I'm probably not the best one to ask. I kind of just focus on what's in front of me.
I was interested in how you showed dendritic connections under different areas of the brain under using psilocybin as maybe making new connections or dendritic and connections to those cells in different areas in neurological pathways. But I thought it was interesting that years ago that they found out the same thing with the MRI of what verbal therapy was doing, was making new pathways also, and that's why verbal therapy was actually working. But people had different ways of looking and making new connections and justifying new things. So I was kind of wondering. I was kind of wondering about how you think that could happen so rapidly. That was the question that I was kind of, because you're talking about one session, because you're talking about, I'm wondering about how you look at those guiders, the guides that are basically going through and identifying, which sounds very typical to some kind of therapy for 8 weeks, and then you dose, okay, and then you're saying, well, now all of a sudden there's new dendritic or axonal connections that might be an explanation biologically for what's going on and why these changes are occurring. I just think that's amazing that could occur in just 14 hours. That's under a dosage. That's what my question is how do you think that could occur, of that kind of neurological growth within a very short period of time?
So it's a great question. I talked to the author of that study, and in a way, I kind of don't really like all this talk that it's really out there in the press of psychedelics. They help your brain change itself, neuroplasticity. Our brains are always changing. If you learn something, your neurons have changed. All drugs increase neuroplasticity. The process of getting addicted to heroin is the process of your neurons changing. And so it really becomes a question of like, well, what and where and all that. I mean, globally increasing your brain's ability to change might actually be a bad thing depending on like what you're doing, right? And so, and yet, like this particular study where the guy, again, these are like mice that are moving around, they're alive, they're not some petri dish thing. Basically, we kind of know how much these dendrites should be changing. They're pretty stable actually in this particular region that he's looking at, and yeah, so the fact that they change so quickly and remain so for, it's like weeks, but that's a long time in a mouse's life, is I think remarkable. There's still a lot more to be done. I mean, like, well, do other drugs do that? You know, like does ketamine do that? It's not actually still all that clear how specific that is to psychedelics. So there's very nice stories to be made out of it. I'm a little reluctant to make too much out of it yet, though, until they nail that down. But though if I had to bet, I suspect that it's an important aspect of what's going on.
Hey, Sandeep, there's a question.
From first,
I want to read out. Do you do any body work or assisted physical support for people during a journey?
Yeah, I should have talked more about that. So basically, this is another way in which psychedelic therapy diverges from typical psychotherapy. So the goal of the guides is to make people feel safe and supported so that they're able to kind of go on their own experience and really engage with it. And so if they're thinking about the outside world, for example, they're not really present. So yeah, fine, we handle that. But also sometimes the simple act of holding their hand can make them feel secure and safe and able to kind of go on. So we talk very explicitly in the preparation about physical touch. And if you think about it, like psilocybin kind of makes people like children in a way. And so they need oftentimes like nonverbal support. Just kind of like, hey, I'm here, you're doing okay. And so I would not say that we necessarily do body work, but we definitely do like physical touch. And that's kind of things that are sort of agreed upon beforehand, hand holding, shoulders. Some people hug. You know, I personally don't. And I think that, like, you know, obviously there need to be some boundaries, right? But yeah, so yeah, I would say that we don't truly do body work, no, but we do definitely use physical touch.
Thanks. Yeah, go ahead, Tom.
I wanted to say that from personal experience, back in the 70s, I had several LSD trips, and I have to say that they're naturally my phone took now to go off. My gosh, sorry, but the extent of them, the effect of them was profound, each one. And I don't have any question that my way of thinking and all sorts of things about me changed in the process of life after those trips. I didn't do a lot, probably not more than a half dozen, but that's more than most people. Mm-hmm. And, but by the same token, I remember a mushroom day when a friend and I thought we were doing mushrooms at the same time, but his was a dud and mine was powerful. And so I learned something about that. If you ever do something that with somebody else, you cut, you share the parts, you know, so that everybody does the same thing, because that was one of the worst days of my life. Speaking of being not supported, and I felt unsupported. I felt horrible. And his memory of it is, oh, you had a trip and I didn't. But my experience was profoundly negative, because I was like a child and needed help.
Yeah. And you didn't really know what you were taking. You didn't know how much you were taking.
I had a really good cap. That's all I know.
Yeah.
All
That was
right.
part of the question. How do you know how much to give people? You know, because I remember being young and people would just say the more the better, which did not always turn out to be true, you know. And sometimes, you know, and then I'd hear somebody go, yeah, I ate 2 of those little mushrooms and I went on a trip, and I'm going, I don't think you did, bud. I don't think that was enough, but I don't know. So how do you guys know what's the right dosage to give someone? Is that body weight or age or?
It's actually not body weight. It's not age. And so definitely psilocybin can be highly variable in its effects, but mushrooms make it even more variable. So like there can be a 10-fold difference in, even if you grow some psilocybin, let's say you grow some cubensis mushrooms, I forget if it's 5-fold or 10-fold, but a huge difference between 2 mushrooms in the same batch in terms of their psilocybin content. Not to mention between batches or between species, right? And so it's very, very hard to actually know with mushrooms how much psilocybin is actually in them. And again, kind of like Tom is saying, like one person can pick a mushroom, the other can pick another, and they're totally different. And so with the synthetic psilocybin, you know exactly how much you're giving. And it turns out how big you are, how much you weigh, that doesn't matter at all. I think I've kind of seen, you know, I've had the benefit of working in a couple of different studies. The ones where it seems to be best is where you get multiple doses and you can kind of start on the lower side and then work your way up. You don't necessarily work your way up all the way. You kind of go to effect, but yeah.
It's not an exact science, it sounds like.
No, it's definitely not an exact science.
Any other questions for Sandeep?
You said that people can a tolerance to psilocybin, is that correct?
Rapid tolerance. So, yeah, I mean, if let's say you take a large dose of psilocybin day 1, large effects, same dose of psilocybin day 2, medium effects, same dose of at some point you will feel nothing.
Really?
Yeah, and that point will happen within days.
Wow.
So yeah, so it's very, very rapid tolerance. And so it truly is not possible to use these in a kind of addictive way that you can with other drugs.
Okay, I want to thank you, Sandeep, for a really informative, really fascinating review of this. And I think it's informed a lot of us, our experiences and our anticipation, and, you know, those occasional curly caps that we find on the ground. So I'm going to let you go. I want everybody, how about a round of applause?
That was awesome. Thanks.
Great, thank
We
you.
can see applauding.
Thanks, everyone. It was my pleasure. You were a great bunch.
And,
Yeah, too bad you couldn't be here for our survivor party that we would normally have.
that would be an interesting menu. Yeah, is that what you're proposing, Bob?
Yeah.
Thanks
Sandy,
again.
go back to Johns Hopkins and keep it up, man. Just keep
Yeah.
up that research, okay?
Yeah. All right, thanks, everyone.
Thank you.
Sounds like a great place to be.
Thank you.
Yeah, thank you so much. Totally fascinating.
Yeah. Take care, okay?
Take care. We're not going to subject you to the you know, hallucinatory effects of our club meeting now, but it's nearly as exciting.
Yeah.
Is there a way to contact you? Like if I was to reach out and contact you down the road or something?
That's my email. Oh wait, whoops. I think I sent that as a direct message to someone. Here's my email. I'm also, Twitter is a way to get in touch with me.
I'll make a question about where can I watch the recording. I'm gonna, it will eventually be on our YouTube channel. I've got to save it and move it over there. But there's always a link to it from our main site.
Yeah.
But we also, if you just go over to YouTube and look for us by name, you will find our channel. And most of our recent meetings are recorded there.
Cool. Great. I look forward to that.
Okay.
All right. Thanks, everyone. I'll see you all.
Yes.
Thank you.